So I'm Dr. David Iser. I'm a gastroenterologist and hepatologist here in Melbourne. I work at 2 or 3 public hospitals in Melbourne, and I also visit a couple of country areas, mainly Bairnsdale now, but I did used to go to Swan Hill.
My name's Piero Baglioni and I'm the practice manager here at Bairnsdale Medical Group. We're one of the 2 clinics in town that run a general practice service. Bairnsdale's in the fortunate position of having quite a few specialists that already visit the town, and they do that on a monthly or bi-monthly basis. We're actually using telehealth as an adjunct to that so that we can value add to that service.
I mean, I've been visiting rural Victoria for 6 years now as a specialist provider through the MSOAP program as part of the Rural Workforce Association of Victoria, and I continue going every 4 weeks, but I've noticed over the last 12 to 18 months in particular that my waiting time has steadily increased, both waiting time for consultations and for endoscopy. So I see telehealth as potentially providing a way of reducing my waiting time for consultation. And I was introduced to telehealth actually by a GP who asked me whether I was getting involved in telehealth, and at the time I admitted that I'd read the brochure but hadn't read it in great detail, hadn't really understood the financial incentives for being involved in telehealth, hadn't really appreciated how it might fit into my practice and how it might save me some travel time, save some patients some travel time, and help the GPs.
We thought it'd be a really good idea so that patients didn't have to travel the 360 odd kilometres to Melbourne to visit their specialists.
After that initial conversation with the GP in Malakuta, I was then encouraged by a patient actually, and he was a regular Skype user and pointed out that Skype is incredibly easy to use and I should not be afraid of it. And so I think I did my first telehealth with him about it, I would have been maybe 8 months ago.
There are 7 specialists providing telehealth to Bairnsdale, but they vary in the level of service that they can provide. So the variation is in the time that they can give to telehealth and in the number of sessions per month that they can provide.
I mean, initially it was just 1 or 2 every couple of weeks, just as I realised that there were patients for whom telehealth would be appropriate. But now I do a consultation session which is perhaps half telehealth. So I just fit them in as normal consultations, 30 minutes for a new patient, 15 minutes for an old patient, slotted in between some face-to-face consultations here in the rooms. For the GP, I think the main benefit is obtaining quality specialist care for their patients who would otherwise struggle to get that specialist care without a long trip. The GP can also be more involved in the consultation by being present and seeing exactly what we're talking about. But at the same time, if they're under time pressure, there's no necessity for them to be involved in the consultation. They can just begin the consultation.
Telehealth helps a patient because they don't have to travel the distance to go and see their specialist. It gives our doctors a more in-depth perspective of what's happened during an interview. Usually they get a letter back from the specialist, but in this case the doctor is actually sitting in there with the patient listening to what the specialist has to say to them. It gives us an opportunity to then follow up on anything that may be needed or may result from the consultation. For example, if they need a pathology request or if they need some sort of other examination, we can do it there and then.
The benefits for the patient, particularly with telehealth, are mainly travel time and convenience. I mean, most of the patients with whom I've done telehealth live 4, 5, 6, 7 hours from Melbourne. So for them to come all the way to Melbourne, that's a 15-hour plus round trip. So the time saving to the patients are enormous.
We've been running telehealth now for near on 6 months, and the patients are very happy with the service. We haven't had any negative comments at all, and they would like to have further consultations of that nature.
Obviously the financial incentives to both the specialist and the GP are significant. Often these are patients for whom any out-of-pocket expense is a burden, and so the Medicare rebate for both the GP and the specialist with no out-of-pocket expense to the patient is roughly equivalent to what most would charge as an out-of-pocket or total consultation fee.